Welcome to Plus Talk on Plus Life. We're all about turning positive into a plus. We are talking about measles and HIV today, and who better to bring us up to speed on it all than Dr. Anusa Chaudhry. Good to see you, my dear.
Good to see you too. It's been a while.
Well, it's because you're a very busy doctor, because you're good at what you do, and that's why we have you here.
Oh, well, thank you.
Measles. Can you believe we're actually going to talk about measles?
Well, we've had a lot of other viruses come through, so
This is true. Let's get down to it, shall we? If someone's living with HIV and they're not sure whether they've been vaccinated for measles, what should they be doing to protect themselves?
first you should contact your healthcare provider to assess to see if you're adequately immunized against measles. If you've gotten the 2-shot series, that's fine. You're adequately immunized. But if you're unsure, the best way to do it is contact your provider, get tested. So it's just a simple blood test to check for your immunity status. If you're positive when it comes to the immunity, then you don't have to worry about this. But if you do need a booster based on your titers, then you can go ahead and proceed to get the vaccine.
And it's 2 shots.
It's 2 shots. Or if you could do a booster. If you've had 1 shot in the past, and let's say you're not immunized, then you just get a booster. It's 1 shot.
Okay, and so we know that people with compromised immune systems are more vulnerable. How can HIV affect the body's ability to fight off a virus like measles?
This is a somewhat complicated question because it depends. It's not just about having HIV, it's how strong is your immune system, not necessarily if you have HIV or
Whether
not.
you're detectable or undetectable.
Right. So it depends on your CD4 count. If it's less than 200, your viral load, how strong your immune system is. If your immune system is strong, you're undetectable, just like the general population, less likely to have serious side effects. If you're immunocompromised, CD4 count is low, viral load is high.
Not on treatment.
Yes, and not on treatment, then higher the chances of getting serious complications from measles, such as pneumonia, encephalitis, which is inflammation of the brain, possibly leading to even death. So this is the reason it's really, really important right now. Those that have HIV, those that are immunocompromised, make that appointment with your healthcare provider and talk about the measles vaccine and your measles immunity status.
So what happens if I'm living with HIV and someone in my household or someone I'm close to or have close contact with contracts measles? What do I do now?
I'm glad you asked me that question, Karl. Number one is making sure to know what your immune status is. So contact your healthcare provider as soon as possible. Get your titers checked to see if you're still adequately immunized. If you are immunized, no worries, right? I would still say that the person that does have measles, make sure that they're isolated. Practice the same precautions that we did during the COVID pandemic, because it is just like COVID, it is spread through respiratory droplets. If you are not adequately immunized, this is the key component, is how strong is your immune system? Because if your CD4 count is not high enough, and your viral load is increased, then your doctor may recommend giving you immunoglobulin treatment within 6 days of exposure.
And what is that?
It's antibodies, basically, to help you fight measles.
Right.
If you are if your CD4 count is adequate and your viral load is undetectable, then you may have the option of just getting the vaccination again within 72 hours of being exposed. But the mainstay too is make sure that you continue your HIV treatment, make sure that your CD4 count remains as high as possible, viral load remains as low as possible, and just be safe.
Yeah, it sounds like just, again, get yourself to undetectable if you can, because then you're at your best fighting form for anything, whether it's measles or something else.
Exactly.
Is it possible that folks are sort of contagious with measles and they don't quite know they've got it yet because they're not showing symptoms?
Yeah. So you can be contagious around 4 days prior to the rash even starting, and then 4 days afterwards. From time of exposure, it takes about 7 to 14 days for you to start developing symptoms. What are those symptoms? Flu-like symptoms, so fever, cold, cough, red eyes, and then the rash starts.
Right. And for now, I think a lot of this is has been focused in Texas. But people do get on planes, people do get on trains, people do travel. So again, I think if we're stressing the point that if you're HIV positive, make sure your vaccines are up to date,
Yeah.
really.
And be cognizant of where the outbreaks are. Are you going to a high risk area, your travel plans, and your vaccination status?
Well, let's sort of switch gears a little bit into sort of vaccines in general.
Mhm.
Um, should folks living with HIV get the flu shot every year, and why would you say that's important?
Yeah, the CDC and the WHO highly recommends that we do get the flu shot, and people with HIV do get the flu shot. And this is because of potentially, if you have HIV, again, going back to your immune system and how strong it is, if your immune system is not as strong, CD4 count is low, viral load is high, then the effects of potentially getting flu and the complications are very severe, again, leading to hospitalization, pneumonia. So this is the reason for getting the flu vaccine. Two is co-infection with flu. When your body is trying to fight the flu in itself, your immune system is stressed, and it may not, again, be as useful in protecting against HIV during that time period too. Do you understand?
Yeah. What about vaccines for things like shingles and the newer Mpox shots? Are these also recommended for people living with
Absolutely.
HIV? Do they carry sort of any extra considerations?
Yeah, so with the shingles vaccine, prior to this, the recommended shingles vaccine is called Shingrix. It is not a live vaccine. And so we'll talk about that. Hopefully, we can talk
Sure.
about that in the near future. But the recommended shingles vaccine is Shingrix, and then the recommended Mpox vaccine is Jynneos. And it's a 2-shot series for both. And it's pretty safe and effective. Again, I would say contact your healthcare provider in regards to getting vaccines, because this really depends on how strong your immune system is. If your immune system is not as strong, this may not be the best time to get vaccines and certain vaccines, especially live vaccines. Okay. Live vaccines, such as rotavirus, I mean, those are for kids, but yellow fever, we talked about travel. Yellow fever vaccine is huge. It's a live vaccine. Even TB, the quantiferin, like the TB vaccine. But these are all live vaccines that really, really, you need to be careful if your immune system is not strong enough.
Well, speaking of that, I think there are a lot of people, and certainly with the news that we are bombarded with at the moment about vaccines in general, there's a lot of people out there who are hesitant. So if I'm someone who's living with HIV who is hesitant about vaccines, what would you say, or what can you say to sort of ease their concerns and perhaps encourage them to reconsider that
Yeah.
hesitancy?
And I can understand that with everything that's going on. Now we have the COVID vaccine, we have the flu vaccine, we have the pneumonia vaccine. It's like, what are we doing with all these vaccines, right? I would say that vaccines is a very simple step for big protection. I want you to think about it that way. One shot for bigger protection, not just for yourself, but for the community. And that's what we're seeing with the measles outbreak right now, right? Not an adequate amount of people are getting vaccinated, so we've lost that community protection or herd immunity that has led to an outbreak. But vaccines are there to help boost your immune system and protect you in case you even, like, say you got the flu shot and you got infected with a different strain of flu, you're not going to get as sick and end up in the hospital.
Yeah.
That's the main goal.
Yeah. Well, Dr. Anu, always great having you in. Thank you for making the time. You are a busy woman, but you speak so well on these topics. So I really appreciate it.
Thanks for having me, Carl. You're busy too.
Oh, hey, that is going to do it for this episode of Plus Talk. What'd you think? Leave a comment below. Let us know. And remember, you can like, follow, and share. We are across all your favorite social platforms at Plus Life Media. And if you want to watch the entirety of this interview, head over to our YouTube page, Plus Life Official. Until next time, be nice to one another. We'll see you soon. Bye-bye.